I'm Fred Cummins. I'm president of the Alliance for the Mentally Ill of Oakland County. And it had something to do with getting this thing rolling. We got a number of other people help us do that. I'm past president of NAMI Michigan also, so I've had a little broader perspectives than just Oakland County. And my wife Hope and I have been advocates for close to 30 years now. We have a daughter who's seriously mentally ill, became ill at age 17. She's now 49. So why are we here? We're here because we're seeing the mental health system go downhill. Maybe not everybody has, but a lot of us have. A lot of us have. A lot of people are experiencing reductions in services. Some people are losing services altogether, and it's not because they got well. We've also got the problem of wages. We're now competing with McDonald's and Walmart and other less stressful jobs to get people to take care of vulnerable citizens and work long hours and late hours and deal with various kinds of disruptions and stresses. That's a serious problem. A lot of providers are having trouble getting people to work for them. And it's going to get worse because in January the minimum wage goes up, but the budget does not. That's just the beginning. Then we have the prospect of privatization, taking what's mostly Medicaid money in the system and giving it to HMOs to run the care, removing accountability from the legislator and the administration, and basically putting a lot of things in the dark. And there's a handout. I had one here a minute ago. As you probably saw, summary of the perils of mental health system privatization, to highlight some of the things that we anticipate as problems of privatization. And that's provided so that you can talk to various people, beyond legislators, talk to other people you know about what's going on with state government and the effects on the mental health system. So we're doing this forum now, right before the election, because we want legislators and candidates to pay attention, and we want to make this an election issue. So the more noise you can make, the better. And we want them to hear from real people who have real problems and how they're being affected by the problems of the mental health system. In January, the Department of Health and Human Services is supposed to make a report to the legislator making a recommendation on how to reform the mental health system. And our expectation is they're going to recommend privatization. And we want to put a stop to that. So, I want you to make these legislators available and any others that you may get to, and we want you to get to know your legislators personally. So this is a starting point. This is not the end, this is the beginning. So we'll start with some brief statements by the legislators. We'll hear from some advocates, and then we'll move on to advocates and the CEOs of, or the representatives from the mental health, the CMH forums. John Kinch is here. I think we had somebody from Wayne County. There he is over here. I think we're expecting somebody from Wayne County to be here. So what I'd like to do with the legislators is just go around one by one and just introduce yourselves.
Good evening, everyone. Nice to see all the concern and all the faces out there in the crowd that are here for this extremely important issue tonight. My name is Bill Sowerby. I'm the candidate for District 31 state rep, and that's the area of Clinton Township, Clemens, and Frazier. This issue is dear to my heart because I used to serve as a county commissioner. I served in the mental health board. I also helped to create what back in the 90s was called pool management for the mental health system, which ended up being an important decision that the county made and statewide. This issue is important to me. The fear of privatization happening at the state level is just not acceptable. So I'm very much anxious to hear what you all have to say tonight. Thank you.
My name is Jeff Yard. I'm a candidate for the 33rd District, which is Richmond, Armada, Memphis, Ray, New Haven, Lenox, and the majority of Macomb Township. I concur with Mr. Salvery on that. This is a very important issue. I lived it personally. My uncle-in-law had birth defects, which gave him mental health issues his whole life, so we've lived it. Also, I'm a paramedic, so for 25 years I've been out assisting people with mental health issues that end up going through the ER system in a pathway to getting help. So I've lived it, being there.
Hello, I'm Pete Lucido, and I'm proud to represent the 36th District, which is Shelby Township, Washington Township, Bruce Township, and the Village of Romeo. Over the last almost 18 months, now almost 20 months, I've had the opportunity of listening to what legislators do every day, but also being an active member now of the legislature for 18 months, 20 months. It's interesting to see the dynamics of individuals who have never experienced anything in mental health. Given the nature of my practice of 30 years as a lawyer before I went to the legislature, I had a lot to do with the mental health division of our court system. And also learning that it's not like it is at home for all of us. But I'm proud to be here tonight on this panel and listen to the concerns, because without listening, you really never know what everybody has to say. So thank you all for inviting us, and I hope to be well aware of what the needs are.
Hello, my name is Diane Young. I'm the Democratic candidate for District 36, which is this district. So it's nice to meet you. But this is an issue that is very dear to my heart. I do have a special needs daughter who requires extra assistance, and I know how valuable it is and important it is. And I look forward to hearing more, and I'd like to know more about how the government can help with funding, because we can talk all we want about things, but if we don't put some money to it, it's just not going to happen. So I look forward to hearing all of your concerns. Thank you.
Hello, my name is Patrick Green. I'm a candidate for House District 28, which is Western Warren and all of Centerline. I want to echo the sentiments of everyone here with me tonight. This is a very important issue that touches everyone, and I want to learn more about it so that I can represent all of you, the people of District 28 in the state of Michigan, when I get there, hopefully in November. Thank you.
Good evening. I'm Dana Camphouse Peterson. I'm running for state representative in the 24th District. I am very interested to hear all your concerns tonight. I currently serve for Executive Mark Hackle and all of you when you're calling up our office and people are asking for needs or accessibility to new vehicles and how can we get it. John Kinch has been a great friend of ours for a long time. I served on the Macomb County Board of Commissioners from 2007 to 2012, and I used to chair the Health Committee. And if somebody understands what you're going through, I will let you know. We live it firsthand. My very best friend and her son is developmentally disabled, sorry about that. And he has gone through a progression of cutting services nonstop. And it's always the caregiver getting cut, the dollars are getting cut. And at the same time, what do? Everybody needs to have service and be taken care of. And so I'm here to listen. I apologize, I'm going to have to leave a few minutes early because I have another event to go to, but it was important that I wanted to be here to hear some of your concerns tonight.
Thank you. I'm happy to be here tonight. My name is Henry Yanez. I am state representative of District 25, which is Sterling Heights and Warren. And I'm a retired firefighter and paramedic. I in this room, both on the dais and then in the audience, has been touched in some way, shape, or form with mental health issues. I know it's touched my family as well. I sit on the Appropriations Committee, and one of my subcommittees is DHS. So I've actually sat through the testimony on this topic. I've had many meetings with our county mental health folks, John Kinch and his folks on this topic. And I can also say that I've sat through a number of meetings for other topics that dealt with privatization services. Not that I'm biased, but I will tell you that I've seen or heard testimony of privatization failing over and over and over again. It failed for our veterans in the Grand Rapids Veterans Home. Privatization of our food service in our prisons are failing. Privatization across the board has been failing. I know that there are no blank checks, but I also know that outcomes should be our number one goal. Positive outcomes should be our number one goal. And we really need to focus on positive outcomes, not how we can efficiently manage the system when it comes to costs. So we have a lot of work to do on this topic. I really salute all the people, both the folks at home who have someone that they love, that they care for, but also the people in the county helping provide these services. They do a great job, and I know that I have their back up in Lansing, and I will continue to fight for good outcomes for families in Macomb County.
Well, good evening. My name is Kevin Ritt. I'm the Regional Director for U.S. Senator Gary Peters. We were happy to receive the invitation to attend these town halls across the state, and Senator Peters is certainly passionate about fighting for families and individuals with mental health concerns, and we wanted to, I'm really looking forward to having the opportunity to hear and learn more about the challenges that everybody is facing and take those concerns back to the Senator. So I just appreciate the opportunity to be here this evening. Thank you.
Good evening, everybody. My name is John Churkin. I'm the current state representative in District 22, which encompasses all of Roseville and the east side of Warren. Being a cop for 29 years in Wayne County, I know the effects of mental health. And unfortunately, even 20 years ago, they didn't have enough money, and today they surely don't have enough money. And so it's a hard road to travel. And back, I want to say during the Johnny Wish days, they closed up all kind of mental health hospitals, and they closed them up as far as 5 years ago. So there's never enough money for mental health. And Mr. Kinch invited me to a seminar town hall like this about 4 or 5 months ago, and I got an education about HAPs and Blue Cross and IMOs and that when it comes to mental health and the privatization of them. And I learned a lot from that meeting, and I'm here tonight to learn also too. So thank you.
Great turnout. Very good. And a great turnout in the audience. Now we're going to turn some more advocacy focus, and starting with John Kinch, your CMH CEO.
It's a pleasure to be here tonight, and I can't tell you how pleased I am to see the size of the crowd here on such an important issue as we're facing here in mental health services today in Michigan. My name is John Kinch, and I'm the Executive Director of Macomb County Community Mental Health. Typically, when I deliver my words and comments, I do it, and I do so in a manner of free association, and I decided tonight I wanted to read it to you. And so I hope you'll just go along with me and have pay attention and certainly offer up your opportunity to listen to what I have to say. I am a voice of the people of Macomb County, and particularly so, I am a voice of the thousands of vulnerable people, many of those who cannot speak for themselves. First of all, I'd like to extend my appreciation to the Macomb House and Senate delegates and those candidates seeking office for taking the time out tonight to learn about our community mental health system, our substance use disorder programs, and our overall system of care. Also to hear of the threats that we are facing over the potential privatization of mental health services. In many ways, I consider myself an authority on the topic of community mental health services. and so from my perspective on the people that we serve. My first experience with special needs child was 42 years ago. That was in 1974. Early in my career, I spent more than 10 years doing direct care work, offering personal care, as well as being engaged in home and community-based case management services delivery. Still fresh are the faces of those children, those adults, and those families who have been affected by mental illness and related conditions. To my eye, to my ear, and in my mind are the serious and complicated challenges these people and these families have endured each day of their life to have a life of fulfillment and happiness. For many, the fulfillment and happiness does not come easy, and for many more, it does not come at all. We, the Community Mental Health Board, the administration, the provider network, and the stakeholders, along with yourselves, are charged with the responsibility for fostering and supporting our people who are otherwise physically, mentally, or seriously disabled, for it says so in the Michigan Constitution. In Macomb County, we are public officials, employees, and citizens who live here in the community. We care about our community in which we live. Our salaries and wages are transparent. Our board meetings are held out in the open air, and our business practices are subject to public scrutiny, as rightfully so. Macomb County Community Mental Health has been a valued and successful partner in providing services for more than 45 years. What works in Macomb County, as well as in other community mental health programs in the state, is our extensive experience with collaborative partnerships with many service organizations in the community. In the public model of care, you will see evidence of partnerships with social services, social welfare, homeless coalitions, public transportation, education, the juvenile justice system, corrections, rehabilitation services, food pantries, the local police, the sheriff, the probate and circuit courts, the Council on the Aging, and also interface with hospital and primary care physicians, just to name a few. For the people who experience many of varying issues related to their life, they rely on the need for experienced providers, those with networking capabilities and having a focus on integrated services. As one takeaway from tonight's meeting, I urge you to trust the importance of community working together. And so, with community and mental health remaining at the table. Along with our community partnerships, we hold pride in numerous evidence-based practice models, in services delivery, and more importantly, for our newest emerging integrated care initiatives, whereas treatment models for people with behavioral health conditions are integrated with physical health care needs. Community mental health has made significant strides towards integrated care initiatives and have shown proof positive evidence of healthcare outcomes in the lives of the people we serve. A point to be made, while I agree with the necessity of integrated and behavioral health care, I think the reason that we're meeting here tonight is more about money, the absence of state money, and the absence of the administrative capacity at the state level to hold the current mental health system together. Based on that premise, then along comes 298 and the state's desire to privatize our system of care. As we all know, health maintenance organizations, HMOs, are generally for-profit companies who establish annual profit margins, often between 15 and 18% of projected revenues. The HMOs take Medicaid revenues, and by doing so, they take federally protected health care entitlements meant for people, and they use those dollars for their profit margins for their companies. While it's not my point tonight to take aim at the HMOs or how they operate their business, I am concerned just the same that privatizing mental health services seems to be contrary to the future direction of the Department of Health and Human Services at the federal government level. The reason being, currently emerging is the Federal Home and Community-Based Services Waiver, called the HCBS waiver, that will come into effect in 2019. The essence of the HCBS final rule federal intent is to protect persons' right to privacy, dignity, respect from freedom, and respect from freedom and influence from control. To respect a person's independence in making life choices. To assist a person's choices of services, supports, and providers. To ensure people receiving long-term services and supports through Medicaid programs are part of the community in which they reside. To have access to the same conveniences as people not in Medicaid programs. To have one's own self-selection among all options available. To choose who one wants to live with. And to have independence in making life's choices. To this end, I'm afraid by history the HMOs have little to no experience in its practices to begin to understand the concepts and uphold these core values. I'm afraid the HMOs are out of time and without experience and ability to assure the HCBS final rule, the federal intent, and what that actually means for our people. Moreover, it is the community mental health programs who understand and engage our people in the richness of person-centered planning and the choice for living self-determined lives. Mental health services delivery must rest with the community mental health services programs. And one more item as we're all here together, because I'm sure it's going to come out. For many years now, the Michigan Department of Health and Human Services has been planning to move Medicaid funds away from the densely populated Macomb County by means of a process called rebase, also known as Medicaid redistribution. Redistribution is currently underway with the reallocation of funds to counties in the western and northern parts of the state of Michigan. 3 days from now, on October 1st, Macomb County will lose tens of millions of dollars in Medicaid funding, which is already having a negative effect on the people that we serve. You will likely hear from some of those folks tonight. These Medicaid redistribution activities should be of grave concern to politicians, policymakers, stakeholders, and all the people of Macomb County who are in this room tonight. I'm going to stick around, obviously, throughout the course of the meeting, and I will be available to answer further questions and be engaged, and I certainly look for your voice to speak up tonight, to be able to assist us as administration and Community Mental Health Board in being able to help educate the legislators who are here. They're here for the same reasons as you and I are. They want to learn more, they want to be involved, they want to protect the rights of our consumers, and they want to have the best system of care that we can offer our consumers. So I really encourage you to take that time out and take the microphone. Thank you.
Thank you, John. Now can we have the representative from Wayne County, Stacy?
I have to apologize. I have no remarks prepared. The chief of staff this morning, or this afternoon, said, hey, I forgot I need to find someone to attend a town hall meeting. And I said, sure, I'll go. And so I just texted him and said, hey, I think they want me to say something. He says, oops, I forgot to tell you that. So I'm going to get him. So I won't speak very long because I do think John covered most of the concerns. Obviously, this is a very important issue because I'm sure we all have things that we like to be doing at 7, 8 o'clock, 9 o'clock at night. I do want to state a few things though. This is extremely important. Community mental health, community. When we receive dollars from the state, and if we've got savings, we reinvest those savings back into the community. We increase rates, we expand services and the like. The HMOs and the health plans, it goes to the bottom line. I'm going to give you a story that, because Detroit is also one of the My Health Link project participants, demo project, as well as Macomb County. And when we were closing the books for fiscal 15, as you all know, the demonstration project started, I believe, in May, and our fiscal year ends in September. We received approximately $5 million in revenues from the ICOs. When we closed out, it was only about $2.5 million in expenses. So I went to my deputy and I said, well, Ron, I said, so what happens with this the difference between what we received, the $5 million, and the expenses of 2.5. I said, you know, what, they send it back to the state? He says, oh, no. He says, when we return it to them, they keep it, and it goes into their profits. So that's when it dawned upon me. I said, you've got to be kidding me. They got to keep 50, they sent us $5 million, and they get to keep 50% of it. It goes to their bonuses. It goes to their bottom line. When we have that sort of savings, you know what happens? We're capped with so much at the state level. Anything else we have to return to the state. But ultimately, we have to reinvest these dollars back in the community. So I just want you all to know that this is an extremely important initiative that we have going on right now, and that we have to stop what's going on. I had the opportunity, I'm a CPA, I'm sorry, my name is Stacy Durant, and I apologize for that because I did not introduce myself. My name is Stacy Durant, and I'm the Chief Financial Officer, the CFO for Detroit Wayne Mental Health Mental Health Authority. I happen to be in, I think, Bel Air at Shady Creek, attending a conference for the Michigan Government Officers Association, licensed CPA, and Lieutenant Governor Kelly happened to be a speaker there, and relatively small audience, so it's sort of an intimate discussion, and I had an opportunity to ask him about 298, and I said, well, why, could you explain why you would want to give health plans monies to PHPs who have an 8% admin rate, and the health plans have a 15% admin rate? He says, oh, those numbers aren't comparable. I said, okay, those numbers aren't comparable. I mean, you've got admin is admin. The state dictates what we include in admin, so I'm assuming that they dictate what they include in admin. If this was the other way around, we unfortunately don't have the ability to use and have significant dollars to lobby, because actually lobbying is not permitted, it's prohibited for us to use our dollars that we get from the state for lobbying. That's not the case for the health plan. So they spend quite a bit of money lobbying. If this was different, and the health plans were, I mean, you would think that if we're at 8% and they're at 15%, I think we should be doing medical services. I think we should get the health care money. I think that's what we need to lobby for. Makes sense to me. So I appreciate John's comments. He's been on point, and we've been collectively working as a team with the Tri-County. Willie Brooks is in the back. I'm glad he's here because now he's going to come speak. That's right. I know. I didn't know I had to speak as well, Willie, so you're next. So I just want to thank you all. I thank you all for taking your time out to come advocate on behalf of the CMHs, and thank you very much. And hopefully I didn't sound like a bumbling idiot, because I had no idea that I was going to be speaking. So sometimes you just got to speak from the heart, speak from what you know, and you can't go wrong with that. So hopefully I've done a good job for you guys.
But I would like to talk just a minute on risk and why risk is so important. One, you need to understand that we're not against capitalism. We're not against privatization. However, we're talking about some of the most vulnerable citizens in the state. In a true capitalistic market, you have winners and losers. That's how capitalism works. You really try and put out your competition. We're in a position that we can't afford to have winners and losers when we're talking about people's lives. In the insurance industry itself, it is risk adverse, which means that they make money by avoiding risk. In other words, if there's someone who has a bad driving record, they would not go out and recruit everyone who they knew is guaranteed to have an accident to try and insure them. As a matter of fact, they would do the opposite. So as many people that they could find that don't need service, economically, it really helps them with their bottom line. Whereas what we do is the complete opposite. We actually go out and look for those individuals that are high risk and try to give them the service that is necessary. And then the other thing that I just want to mention that's really important is if you look at the difference between healthcare and community mental health care, and I know both areas. I was in the private healthcare for 22 years before I went over to the good side. But what's important to realize on the health side, there's only so many dollars that you can give for an illness. For example, if someone breaks the arm, it doesn't help to add a golden cast or to do a lot of extra things. You basically just want that arm healed, and then that's the end of it. But when you're dealing with developmental disabilities and mental illness, as you add more dollars, you increase the quality of life. So you can have more therapists, you can have more things that can have them involved in the community, and you want to make sure that these three things occur. One, you want to make sure that people have choice. Two, you want to make sure people have inclusion. And then three, you want to make sure that people have the full life experience. If we don't do that, then we're going back to institutions, we're going back to asylums, we're going back to people deciding what is best for someone else without individuals having a voice. And that is our job, to make sure that the people we serve have a voice. Thank you.
Thank you, Willie. All right, next we're going to hear from four advocates, people who have been involved in organizing this. I'm sure they're going to keep it short, but starting with Nick Cimitero.
Thanks, Red. I'm going to try to be very brief, and as most people who know me, that is not an easy thing for me to do. My name is Nick Cimitero. I'm Director of Legislation and Public Policy for Michigan AFSCME, which is one of the sponsors of this organization, and I'm also a member of the Macomb County Community Mental Health Board, which is also the PIHP here. So we obviously have a lot of interest in this. And before I go into any remarks at all, I do want to acknowledge the other members of the Macomb County Community Mental Health Board that I've seen. If they stand up in case I've missed anybody, please, for a moment, to be recognized. They include our chairman, Ken DeBozard, Joan Flynn, Linda Bush, Marilyn Brown, Dr. Barry Cross, I'm sorry, and I see Commissioner Toko has just joined us as well. So please acknowledge that the board has come to join us. There it goes. I'm going to give you the top lines of my remarks because I do think we want to get to the reason we're here tonight rather than hearing from those of us, and you guys get to hear from me all the time anyways. The fact of the matter is that the discussion about privatizing, and that's I think a misnomer, outsourcing the services, which is really just taking public taxpayer money and handing it over to private interest groups to manage. It doesn't save taxpayers money. In fact, it generally ends up costing you more. And about the only way it ends up saving you money, as we've seen in other areas where it's been tried, is to reduce dramatically the amount of service provided, and we need more services, not less, in this particular areas. Representative Yanis pointed out, we've seen the problems that it's caused in food service and prisons, in the serious reduction in services that our veterans receive at the Grand Rapids Home for the Vets. We're beginning to see some serious problems in the juvenile justice field, where kids who should be receiving services in juvenile justice facilities after closing places like Maxie are now being stuck in holding cells or in private prisons, not private prisons, but even public prisons where they don't belong. And we're beginning to see a direct care staff crisis because we can't get enough dollars out of the state to pay direct care workers a fair wage, and in so many other areas. That's the number one reason usually given, and it has been proven to be false over and over again. The number two reason, and John alluded to it, that we're seeing here is an argument that we need to coordinate physical health and so-called behavioral health. That's correct. We do need to do that. But there are much better ways to do that that won't result in the kind of bleeding that we see through privatization. Here in Macomb County, we're already looking at an experiment using or seeking grant dollars through the program that Senator Stabenow and Senator Peters have put together at the federal level to help pay for, called, I always get the acronym mixed up, I'll put my glasses back on, Certified Coordinated Behavioral Health Clinics, which would work with public federal health plans, programs, to coordinate both for the physical side and the behavioral health side. So there are ways to do it without losing what you lose in the case of privatization, outsourcing, whatever you want to call it. That kind of coordination is good, and it can be done that way. The dangers of shifting more than $2 billion, and that's what we're talking about, shifting more than $2 billion of federal and state money from public control, agencies that are appointed by public elected officials, to local HMOs, to private HMOs, will result in a huge loss of transparency. You can come to our board meetings, you can't go to their board meetings, and a loss of accountability. Private insurance companies are responsible to their board of directors. They're not responsible to the taxpayers, and it's the taxpayers who are responsible for these services. And I won't go into details on the overhead cost increases, because you've heard it from others as well, but that's a very real problem. Rather than bleeding money out of the system, we need to add more money because of the need for services. And I'm going to quit early, so to everybody's surprise, so we can hear from all of you, which is really why we're here tonight.
Well, first of all, my name's Liz Bauer, and I want to thank you all for coming and for listening. You're our future. You make decisions, and they're going to be informed by the people that use the services and to whom you're really accountable. Mr. Kinch spoke to the array of services that persons with mental illnesses, intellectual developmental disabilities, and substance use disorders use. Stacy talked to the difference in the bottom line in a public service versus a private HMO. Willie Brooks outlined risk. I'm not going to say anything about those. What I do want to say is the mother of a 49-year-old woman who uses services from one of the providers that is a dually eligible person for Medicare and Medicaid, that I watch that My Health Link program like a hawk. And I actually am on one of the state level committees, so I get to watch it really closely every 2 weeks in a minute. It's a pilot project in Macomb, Wayne County, a few counties, Southwest Michigan, and the entire Upper Peninsula. What I want you to know is that people are passively enrolled in this, and if they wake up, they move out of it each week. A few people less are staying in. It does not serve persons with intellectual disabilities who have long-term needs. It might serve someone well who needs a doctor appointment and needs to be connected to a doctor. But what's happening in that program is lack of choice. You heard choice is important. People go to their familiar doctor and he says, I'm not in your plan, and they didn't know they had a new plan. And then they're told that they have to go to the HMO, and the HMO says, well, we have our doctor, and if you want your doctor, then you have to convince him to join our network. That's a burden for someone with an intellectual disability or a psychiatric problem. So we know also from the Affordable Care Act that insurance companies, when faced with high-cost individuals, pull out of the program. And what I'm very much afraid of is these HMOs who are really eager to get their hands on $2.4 billion with a B, once they discover who they will be serving, will back out. And if they back out after we have decimated the current system, there is no place to go. We have to speak. You need to listen, and thank you for doing so.
Good evening. I'm Mark Reinstein from the Mental Health Association in Michigan, the state's oldest advocacy organization for persons experiencing mental illness. I'm also involved with the statewide Mental Health and Justice Coalition, known as Michigan Partners in Crisis. It's gratifying to see so many concerned people here tonight, and the best thing I can probably do for you is give you a report from the front lines in Lansing. When in February, the governor made his privatization proposal, which had never been discussed with consumers, families, and advocates. Let me repeat, before he made that proposal, it had never been discussed with consumers, families, and advocates. It resulted in a flood of complaints to the legislature. Lieutenant Governor Calley decided to form a work group on the issue. He appointed 120 people to it. The work group met 5 times, ending in June. The work group rejected the governor's proposal and made 28 recommendations for structural and operational matters in publicly funded health care. Included were some things that have been very important for years to consumers and families. For example, open access to Medicaid mental health medications, independent mechanisms for judging consumer and family complaints about their services, improved person-centered planning, greater uniformity of practices and procedures across community mental health programs statewide, and reducing the layers of bureaucracy and duplication we have today in publicly funded behavioral health care. In July, the Department of Health and Human Services pulled in a small group of people to start looking at next steps, because as Fred Cummins told you, a report to the legislature is due January 15. It became obvious to advocates on the new group that the department had little interest in what the Calley work group had produced. The advocacy groups came within a millimeter of dropping out of the new work group, but the lieutenant governor intervened and fixed some things, and the advocacy groups have remained so far. Instead of concentrating on critical policy and funding issues, the new work group has focused solely to date on new types of public meetings the department wants. One type would be for consumers and families. Another would be for service providers, and a third for service payers. The first 2 sessions for consumers and families have been scheduled for the afternoon of October 4, 1 to 4 p.m., and the evening of October 5, 6 to 9 p.m. at the Hannah Community Center in East Lansing. Now, late this afternoon, the department put out an email statewide talking about where it is in the process and talking about these 2 upcoming meetings and saying that it is their hope, their intent, that there will be more public meetings for consumers and families than beyond just the 2 in East Lansing. That email that went out late this afternoon also tells people that they have the opportunity to respond in writing to the questions that will be asked at these forums for consumers and families. There are 12 question areas, number of which have multiple specific questions that will be asked at the forums. And this afternoon's email did indicate a website that people could go to get the questions and to answer them, and then where to send them. Now this afternoon's email did not, as far as I could tell, include a date by which you have to respond. But unofficially, I believe you have till the end of October to respond. And if you don't wind up at any of the public forums that are going to be held, the website to go to is www.michigan.gov/stakeholder, one word, STAKEHOLDER 298, and no spaces in there. So that's www.michigan.gov/stakeholder298. Once you're in, if you click on affinity groups, AFFINITY, affinity groups, that supposedly will get you into the 12 question areas that are going to be asked at these public meetings of consumers and families. The questions later on for providers and payers won't necessarily be the same. And this supposedly will tell you where to send your written remarks. I think we're all in a precarious position. No one knows exactly how it will turn out. But I am not giving up, and no one here tonight should give up either. There is still time for your voices to be heard. Please use those voices. Thank you.
Thanks, Mark. I'm Margie Mitchell. I am the Executive Director of MICHUHCAN, a health advocacy organization, and also on the board of a group in Wayne County called Community Opportunity Center. We service 95 adults with developmental disabilities in the community. I want to talk a little bit about insurance companies, whether it's for-profit or not-profit. How many of you have had problems with insurance companies in the past? Just about everybody. My personal story is that when I had my first cancers, and I've had 4, I was asked by my insurance company, which I'm no longer with, to have a second opinion. My doctor wanted me on the table that week. They asked for, I got my second opinion. It took a week. And then they wanted a third opinion. It left me feeling like they wanted me to die so that I wouldn't cost them any more money. And that's what Mr. Brooks was talking about the risk. They make money when they don't provide services. And that's not what we need. Let's call it what it is. This is an effort to, quote, save dollars. There are dollars. There are taxpayer dollars. We should have a say in how they get spent. Saving dollars is not saving lives or supporting people who are most vulnerable in our society. I'd like to remind people of something that George Lakoff said. Privatization and deregulation are seen as virtues that lead to less government. That is a fallacy. They lead to less responsible government because of the way that it is done. And then I want to remind you what Oliver Wendell Holmes said. Taxes are what we pay for a civilized society. Again, it's our dollars.